So one of the things that has been challenging in heme malignancies is that we know that some cancers depend on the anti-apoptotic protein MCL1 for their survival, particularly in the context of refractoriness to BCL2 directed therapies like Venetoclax. But unfortunately, direct inhibition of MCL1 has proven to be challenging due to some cardiovascular toxicities that were observed with those drugs. So the idea with Voruciclib is to target CDK9, which actually is a transcriptional regulator. And so when you inhibit CDK9, you inhibit transcription of the short half-life proteins like MCL1. So this is actually a way to indirectly inhibit MCL1. And so what I'm reporting on at this year's ASH meeting is a phase 1 clinical trial of Voruciclib that was in patients with relapsed AML or relapsed B-cell malignancies. About 40 patients in total, 20 or so in each arm of the study. And patients were treated in dose escalation fashion to identify a safe dose of Voruciclib in both diseases. There were a couple of DLTs in the AML cohort at 200 milligrams of Voruciclib. These were both cases of interstitial pneumonitis, but other than that, the drug was very well tolerated for most patients. And so that was a dose that was taken forward, but at a reduced dosing schedule. So instead of daily dosing for the entire 28-day cycle, patients were dosed at 14 consecutive days out of the 28-day cycle. And by doing that dose adjustment, the patients actually had much better tolerability. There were no further DLTs, no significant myelosuppression, some mild GI toxicities like diarrhea, but overall, patients tolerated the drug well. There was some activity in patients with AML, including a patient who had a dramatic reduction in blast count. So there's some initial signs of activity. We also showed some correlative studies in this presentation, including reduction in MCL1 protein levels, as well as RNA POL2, which is another marker of inhibiting the target. So it seems like now, getting up to the higher doses of Voruciclib, the target is beginning to be inhibited. We're seeing signs of clinical activity with good tolerability. And so moving forward with this study, there's now in the AML cohort a combination of Venetoclax with Voruciclib, with the idea being to try to do dual inhibition of BCL2 and MCL1, which we think is a very promising strategy, particularly in that disease.